All right, welcome to Researching Happy. This is the podcast all about the stories behind the studies of the happiness and well-being world. And my name is Matthew Aiello. If you can tell, this is not a high-end studio. This is a room in my house. It's 6 a.m. and I try and record these before my family wakes up, but that wasn't the case this morning. So I've got a 7-month-old crawling around that you might hear. It's all part of the fun. And this week we're extremely pleased, we're extremely pleased to have Nancy Hay on from the What Works Centre of Wellbeing in the UK. And what we're trying to do with the show is to bring the best examples in the world of people who are, researchers or around the world of research in some way, who really have incredible stories to tell. And I think the work that Nancy's leading with her team is amazing. It's a social good, not just for the UK, but for the rest of the world, pulling together information about well-being and collecting all this valuable data about well-being, and then summarizing it for, in really usable ways for, government, for business, and for social sort of community groups as well. I think is just incredible. I was going to call this episode First You Get the Data, Then You Get the Information, Then You Get the Wellbeing, but I thought that would be completely stupid and make no sense to anyone. But it is kind of the point, in a way, without the Scarface, connotations. But enjoy this episode. Nancy was an absolute thrill to speak with. So fun. Wait till we start talking about the Premier League and soccer, and the highs and lows of being a soccer fan. So I'm trying not to be distracted by this little one who's going straight for everything dangerous. You can follow this episode wherever you're finding it. That really makes a big difference for us to try and get the word out about the show. You can subscribe and you can support the show from $5 a month on a system called Locals, which is very much like sort of like a Patreon, but an alternative to Patreon. And otherwise, just enjoy the show. So thank you. All right, so welcome back to Researching Happy. We are extremely pleased to have Nancy Hay with us today. I've got a little bio about you here, Nancy, so I'll just kick off with that. We were just discussing off air that we have met once upon a time. I think that must have been 2015 or 2016.
It was
here
a long time ago now.
Yeah, feels like that. But really pleased to be sort of connecting back with you. So I have a little bio that I took off your website. So Nancy Hay is the Executive Director of What Works Wellbeing. Prior to setting up the centre, she worked in the UK Civil Service in 9 departments as a policy professional and coach, delivering across UK government policies, including constitutional reform. She holds a wide range of advisory roles across the UK and globally to bring evidence into decision making and to fill evidence gaps. She's a fellow at the Royal Society of Arts, McLean Hospital, a Harvard Medical School affiliate, a fellow of the Zinc Academy, and a leadership fellow at the Windsor Castle Society for Leadership Fellows. So welcome.
Thanks for having me, Matt. It's great to see you again. I was just
really
looking back and I worked with the director of the initial centre back in 2014-15 as we were both setting up the organisations. So it's a long history of the relationships. It's great to reconnect.
Great. No, I really appreciate that. And so, I mean, I want to start basically there, I guess. So the organisation that you've founded, I think, is that fair to say, is focused on accelerating research and democratising access to wellbeing evidence. I would like to imagine that someone out there hears that goal and thinks that's such a good idea. you can have all the money you need to run that because it's such a valuable thing for society. Has that been your experience so far?
So I was the founding director of the centre, and we were launched in 2014 on the back of the Commission on Wellbeing and Policy by the then Prime Minister and former Cabinet Secretary in the UK, so the top official. And you'd think that was a fantastic platform to attract a whole range of funders for this absolutely brilliant cause. And actually, in particular, what we're trying to do is create a learning system for
Mm.
well-being, and we democratize and make accessible is the tagline. But what we're doing is finding, sharing, growing learning about well-being with everybody across government, across business, across the voluntary and community sector, and making that available so that everybody can use it and add to that evidence base. So it's a public good in that sense. And we have been really lucky in having really fantastic partners and investors that allowed us to really crack the back of making some sense of this and making it practical and realistic, and doable and achievable. And you'd think that everybody lined up to fund it. What we find is, it is everybody's business, but nobody's absolute top priority and lead.
Yeah.
So there's no
Yeah.
department in government that leads us, and this is the same in almost every jurisdiction. It's the purpose of everything government does. It's the purpose of everything that civil society and charities do. So you'll see it in 100-year-old charitable purposes. Their purpose is societal well-being, and yet they'll be focused on one specific bit of it or several specific bits of it. It's quite big, right? So they'll go, we're going to improve societal well-being, and we're going to focus on housing, crime, and poverty, which are fantastic things to focus on. Don't get me wrong. But there's nobody who goes, oh, this overall well-being thing, that's my baby. Let's focus on that. And so I think that is a really big challenge. It's everybody's interest, but no one's core interest. So yes, I think funding is challenging, but we were super lucky having a cross-government, cross-sector partnership over the last 9 years, and we still continue to do that. But this fact that it isn't somebody's core focus, but
Hmm.
everybody's interested, is a real challenge, I think.
Yeah, no, we've definitely have guests having that issue, and I think particularly in Australia, there's been a few that are sort of lobbying that it is just a missing department, basically, like you say. Um, so tell us a little bit about, what was, so 2015, I think I remember I kind of just joined our center at that time, and wellbeing was, um, well, it was kind of a dirty word, I have to say. Like it was still in the, pop psychology kind of world. I think when you walked into a university or a scientific institution like ours, or into a government department, I think they weren't thinking very seriously about well-being. That's completely changed, in the last 8 or 9 years. But give us a bit of background of what was happening at the start of your center.
So yeah, we did start in sort of parallel actually. So 2014-15 we were setting up. So I think there's a number of things in your question that I think are really interesting. So one is around sort of the context for our centre and where it came from. The second is sort of the language that's used around well-being, and
Hmm.
how seriously it's taken, which I think is really interesting, but also the growth of the academic field as well. So I might take a bit of those one by one. So
Yeah, sorry.
that are no, but they're all important aspects of the journey, and actually they're important for the conversation we're having today. So the word well-being, people tend to think is quite fluffy, and that's partly because of the very public conversation there is around well-being. Is often associated with particular products or services, often closely associated with white middle class women, which of course I am, but that doesn't mean that's what it is. um, I I think the common thing when I've done a presentation, particularly around wellbeing at work, is I think I was doing it to enforcement professionals, and they said, "Oh my goodness, what you've just talked to me in 45 minutes is so not fluffy. You've really changed my mind. And I think that perception is really interesting one. The language itself is, but it hasn't stopped it ballooning. So I was looking at the Google Trends yesterday, and I changed the hyphen of well-being, which is the grammatically
Yeah.
correct term that was used pre 2014. And I took it out just for digital awareness so that you could read it more easily on the screen. And the search terms for well-being without a hyphen they're in their billions versus now, whereas they were in their sort of hundreds of thousands in 2014-15. So whereas well-being with a hyphen is still quite small. But that well-being with a hyphen is interesting because there are lots of conversations that happen. So there is this public conversation, marketing one. It's actually everywhere in the public psyche. It's quite a sophisticated conversation, actually. Commentators on all sides of, you wouldn't expect, totally relating to it. It's a very human thing, and people take it with them. But in politics, it's very difficult words, and I've seen it talked about in different parliaments in different ways. And that's partly because you've got a conversation that's happening in statistics and economics, which is where I started this from a policy official perspective, which is quite a different one to the psychology one, to the mental health one, to the sort of wellness one. They're not necessarily on different bits of the evidence base. Actually, there's a wonderful PhD by a fantastic researcher that said they're using the same evidence base, but what makes you credible in one sector is the opposite of what makes you credible in another. So if you're happy with those two polar opposites of bits of the magnet, that's fine. Okay, so what makes you credible in an academic setting is very different. And actually, you may or may not choose to do those things. But where do we come from, which is a different question. So well-being has been measured in research from and policy making statistics from 1990s onwards, probably earlier than that if you go back. And that's a really important change that happened, that we started measuring at population level things that really positively matter to people's lives. And that enabled some really great science to happen that then policy could use. And so we're just doing a policy timeline here in the UK. And I think the first citing of wellbeing in legislation happened in around 2000, following those early 90s things. And there was some really interesting consideration of the data that was thrown over what that meant for policymaking in the early 2000s, which when I started getting involved in this and looking at how citizens related to the states and constitutional policy, in case you're wondering. But so there's a conversation that's happening in statistics around going beyond GDP, which is around well-being. And so the statistical offices around the world have this really sophisticated understanding of what that means. That is those statistics that go beyond just monetary market value for things allow us to basically put some numbers and words to things that we were already doing in social policy making anyway. But we can do it with much more rigor, and we really need to, because otherwise we're potentially causing harm, which is the what works bit of what we do. And then there's also a conversation in economics, which is shifting from welfare economics to well-being economics. So the goal of economic policy is improving people's lives, which we call well-being. And so this economic discussion has always been there. We're just better able to measure it now. And so you've got these different conversations happening and all the science coming together, including from psychology and health and different areas. So we came following this legislation. There's quite a lot of legislation in the UK around well-being now. Laws that allow you to do it and means you have to do well-being in policy making. And then in 2010, we had the National Measuring Wellbeing Programme across the UK. And that consolidated the metrics into the National Measuring Wellbeing Framework, which is being updated this year. And there was a big focus on how you use that in policy making from 2010. So I was working with civil servants across departments to understand, okay, what do we do this? How do we use it in practice? And there was a commission then on wellbeing and policy, in 2014, which looked at the evidence and what you can do about it. And then on the back of that, the Prime Minister said, we're going to set up this centre to understand what people in government, business, civil society, and the public can do to improve well-being. And in making that information available publicly, it doesn't need any one person to be the gatekeeper for that action, and we can learn together. So that's where the centre came from. And actually, it brings together lots of different communities who think about this in lots of different ways, from civil society and charities, which really comes through from the wellbeing data as something that really matters, to the economic conversation, to the policy making conversation, to the statistical one, and the wellbeing economy one. So it doesn't. It's nobody owns this. We're all holding one bit of that puzzle, and ours is a very practical one about, okay, how do you do this in practice? And the language is just, we're often talking like across each other about the same things for really good reasons, but it's annoying.
Yeah, look, it does strike me that some of the most exciting work is coming from the UK at the moment. I don't know whether that PhD student that you were talking about, whether that was Mark Fabian by any chance, but we've had
It
him
wasn't
recently
Mark.
on.
It was a fantastic woman, but Mark, we've worked with it as well. So the other thing that
Great.
we've also
Okay,
been
cool.
actively trying to do, we funded 4 academic consortia across the UK, across 4 different
Okay.
areas. So we had well-being overall, we had community well-being, work and adult learning, culture and sport, and then we did some further work on loneliness and deeper methodological things, which included Mark's work. And the goal there was also to grow the academic capacity across the UK as well, so that there are people researching well-being in every top university in the UK, which we now have. You can get a job doing exciting well-being research in every part of the country, and in quite a large number of disciplines. And we have a large number of professors now, people who've worked on that program who are now professors, which is just fantastic. So
Wow.
if you want to research
Wow,
well-being, well,
fantastic. Yeah, I was going to
UK is a
say
great place to do it.
yeah, great. I was going to say it's the UK just does feel like a bit of a hotbed right now for this activity. And most of it does seem from my perspective to come from the multidisciplinary nature of the work. And you know, obviously, like we said, we've had Mark on the show, and he's kind of like, in my mind, the poster boy of multidisciplinary work, bringing together philosophy, economics, and psychology, obviously, and public policy as well. But going back to what you were saying about language, it's almost that it seems like the UK is progressing this much faster than the rest, because you are starting to clarify what we actually mean by some of these terms.
Well, yeah, I'm really excited to hear you say that. That was my goal setting us up, and I really am excited that. So as a centre, we're a bridge, right, between these different sectors, and a sort of space where all of the so for a learning community to work, you need everyone to have mutual respect, mutual trust, and mutual freedom of expression. That's across disciplines, that's across academic, policy, and practice. And you need everybody to be able to talk roughly the same language. So we translate a lot and make it easy, accessible to people to talk to things. And that's quite important. Like, we're translating not into different languages, as in we do have people who have got different languages in the team, but it's almost like, do you speak health? Do you speak economics? Do
Mm.
you speak and what language works in the charity sector, or things like that, and so that it makes sense to people, so you've got this shared mental model about what you're working with. So some of the work we've done, particularly around community well-being, and loneliness, has been conceptual, working out what we mean by these terms, and then indicators, how do we measure this stuff, why have we chosen those particular measures, how does it fit together. And so it has been systematically building, particularly where you have, like in healthcare and education, you've often got quite an established research field over decades, right? Whereas in many
Hmm.
areas of this area, we haven't got that yet. And that doesn't mean the evidence
Yeah.
isn't good enough. It means we're not good enough yet. And how do we grow that in a respected and respectful way? So that's been
Yeah,
really
and
very
I
much
think
part of what we try to do.
great. Yeah, I think a really concrete example of that, we've just been writing a grant at the moment for to try and deliver some of our work into cancer survivors, or actually people diagnosed with a particular cancer, because we're in this medical institute, as you'll remember. So we have been trying for a while to get. I mean, we've been doing a pilot in breast cancer survivors, but I remember hearing one of the collaborators almost saying like, "Oh, we don't need to measure well-being because we've got quality of life, measures included." And when you pull out those, like, which is an error, I thought, a misconception I think you hear all the time. When you go and you sort of show them, like, here's what we mean by well-being, like a sense of purpose in life, sense of meaningful relationships, happiness, blah, blah, blah. Then you pull that up to the quality of life measure, which was about, how able are you to get dressed in the morning? These are very different things. So just to kind of paint that picture for anyone who's trying to understand what we mean by this
Yeah,
language
and
issue.
actually, that's really important. Actually, so in the UK, we've got the QALY, which is the health-related
Yep.
quality of life measure, and it's fantastic. Really, really helpful. Transformed how we invest in healthcare, and actually, particularly, we've also got NICE, which is a what work centre as well, like us, which is looking about cost effectiveness. Well, effectiveness first, and then cost effectiveness, and that's what we're trying to do for well-being. The
Yep.
challenge with the QALY and why what we're doing matters is its health related quality of life, and that's
Mm-hmm.
really important, and it's particularly useful in that context. How do you do it for other things outside healthcare? Is one problem, but there's a number of problems, particularly with the QALY, that we're trying to improve on. One is in assessing the QALY, we're asking people to predict how they will feel when X or Y happens to them, and but then to put a monetary value on that. And there's two problems with that. One, we're really bad at anticipating what will happen to how we'll feel when something happens to us. And we're
Yep.
even worse at putting a monetary value to that. It's beset by all sorts of anchor effects. So, what well-being does, particularly measured by life satisfaction, not the only measure that we care about, but one particularly good one, is it's essentially a measure of lived experience as defined by you or me. Our own one's quite democratic in
We,
that sense. And we can put a well-being value on different changes in money as well, which is exactly what we do, expanding that methodology, which is exciting. And what we really need is better, more randomized, more causation studies to help us get more values
Mhm.
that help us with this. But it allows you to compare the impact of a healthcare intervention, like a direct healthcare one, with a psychological intervention, with a like getting people physically active, but also with things like sewage leaks or energy efficiency for low income housing, and then it becomes a game changer. Really exciting.
Yeah. Yeah, great. And I think I've heard it many times before. I think seems like your team are working on this too. That idea of the well-be, so the well-being sort of equivalent of the quality. That there would be many interventions out there that would improve your well-being, but not your sort of quality of life in a physical health sort of sense or in a health related sense. And if there are, you know, charities or non-profits doing fantastic work, they're actually at a disadvantage without having these measurement tools at their disposal.
I mean, everything you do in a charity is for the purpose of improving somebody's life, right? And that's what I
Mm-hmm.
would call well-being. And
Yep.
chances are what you're doing probably helps, but like it would be really good to be able to know which like like charities often don't have a lot of money or they're relying on volunteers. So how do you make the best use of that effort that you're putting in? Like how can you have the maximum impact? And that's where we focus. How can you have the maximum impact on people's lives, basically?
Great. All right, great. So we're just dealing with some technical difficulties. Thank you, Nancy. I think we've been having a slight delay here, so this should be better now. Where I wanted to go to was to hear about. It seems in a really basic way that what you're doing at the What Work Center, you're collecting data, and I think you're a sort of a repository for data, but you're also then doing reviews of evidence. So I wonder whether we can start with the data collection that you're involved in.
So we're trying to understand what organisations in all sectors can do to improve well-being, and we're also
Yep.
wanting to make in order to do that, we're also trying to make available the data that tells us what makes us happy so other people can act on it. So making it public, revealing it, communicating it, actually, very, very simply, communicating it. Like, you can't act on it if you just don't know about it. And so communication is something we do as the core thing that we do. But there's another reason on the data. So one is about just showing you what actually, you know, I said about people were very bad at predicting how they will actually feel. Actually showing people the data really helps do that, but also just enables many, many people to act on it, which is really exciting. So that's one thing about what we're trying to do is show what the evidence says to as many people as possible, and that's what the National Lottery Community Fund helped fund it. The other thing we're doing on data is the UK has national statistics on well-being, and a large number of measures actually, but it also has over 10 years of population level wellbeing data that in over 30 sorry, lost my headphones, and over 30 surveys, and a lot of other data sets. So we've got lots of sort of studies that follow people over time. We've got just huge amounts. What surprised me is, so the policy decision there was to collect this data and to fund that data collection as national statistics, but in all these surveys. But then it wasn't being used by researchers in the way I had just thought it would do. And so, we've done some of it ourselves, quite a lot of it ourselves. But also, we're now publishing the code so that as many people can do that as possible. So what that means is, and so actually we did some of this with you guys. We looked at your fantastic survey, and yours was clever because it had social capital, well-being and health in it, which allowed us to understand about feelings of control that mattered, about the fact that people with asthma had were worth looking into further, for example, in a way that we hadn't been able to do before. So we want to do more of those types of studies, happy to collaborate on those, really excited. But what we find is there's lots of people who want to do that, but it takes sort of 3 months to download the data, work out what it says, get access to it, how the variables work. And then we were also seeing when we were collating the evidence. So our job is really to bring it all together, look at where we're at in the journey of learning, make that available so that everybody can do it. So we're continuing to build on this together collectively on this learning. So that's why reviews are so important. But if we were seeing some common errors, things like in the evaluation reports, which are just locking down the quality of them, so we can't have as much confidence in the findings. So things like comparing to the wrong benchmark, using the wrong year, just using the wrong low, medium, high bandings, like not understanding how the data works, really. Yeah, I mean, it's totally possible to do if you know what you're doing, but like everybody was learning it. So we're trying to make that easier to do and cheaper and quicker. So if somebody else is particularly like the time use data, which is just so many, like so many data points, how can we make it quicker and easier for as many people as possible to use, and keep building the quality of that code, and keep building the number of people who know how to use it, and just like takes 3 months off that, and think about how much research money that saves, and it means you can then do it as a master's project or part of your PhD without having to spend a year on it. So that was part of the thinking on that. So please use it, let us know, upload your code, share it, let's learn together.
How do people find that?
We've got a data repository on GitHub, but it's on our projects. I can share it. It's called Accelerating Data Analysis, and there's quite a lot there. Great. So you can see, for example, how local authority, like individual county level wellbeing has changed over the last 10 years, that sort of thing.
Yeah, it's just so it's one of the reasons I love following you on Twitter, because you're like the Twitter wellbeing fact checker. Because I think I see people sort of putting out things, they're either asking questions or they're just making some sort of assertion, and then I just see like Nancy pops up, actually, here's 10 years of data on that thing, so you don't even have to worry about it, we've already got it covered. It's just so powerful. I mean, that's obviously a bit of a silly example, although it is informative. It just seems so powerful, and I just I'm hoping that there's a huge uptake, but I don't know how that's sort of looking.
Yeah, we get, I mean, that's my job, is to get the evidence. So we can push the evidence out when it comes out. We can communicate it. But 70% of people who use our site are new to wellbeing, right? And we're
Okay.
constantly bringing in new people to wellbeing. So if you think about it, that makes lots of sense. You've got people who are super keen, innovators. You've got early adopters, and then you've got people who continually come into this field and want to know about it, and that actually makes loads of sense, right? So how do you keep communicating to these new people who are new in, who want to do this? And the other thing is that people come into wellbeing, look at it and go, oh, that's really interesting. Oh gosh, look, we must do something on skills or housing or hope. And so they jump into that, or children and young people's mental health, and that's great. And so you're helping people find the way, but they're no longer in the wellbeing space. So um, very much part of the job is to sort of show what's already been learned so we can keep learning. So what often happens is things keep looking innovative and we keep getting the same research again and again. And that's great if
Yeah.
we're trying to establish confidence in that, those findings. Like if multiple robust studies tell us the same thing, it's probably true. And that's great, but we don't need any more before and after studies of mindfulness interventions. Please don't give me any more of those. They need to be much more sophisticated if they're going to be any use now. Whereas there are other things that we've been doing
So
forever that need researching.
yeah, no.
But fact checker is good, right?
Oh man,
That's
it's
exactly our
just
job.
perfect what you're saying. Just completely perfect. I think we've just we've just done a big review. We can I can't talk a heap about it. We were talking a bit about it before, but my colleague Joop van Achteren, who has been on the show as well, he kind of made the point that we almost need to write a research wastage paper, purely from the fact. So spoilers, Joop. Sorry if you wanted to get the punch out there, but this idea of like we found more reviews of like more systematic reviews of mindfulness than like anyone could ever possibly need, and then like you said, they're not actually answering the tough questions because at the moment all we can answer is does it work, yes or no. That's as sophisticated as we can get at the moment because no one's running anything other than those sorts of trials.
There are some great studies starting to happen, though, actually, which is
Oh no,
really exciting.
absolutely, absolutely.
But it just needs to
No,
take that next step. And we need to
yes,
cover these other
yes.
things. I love the review work that you guys have done. We use it a lot, so thank you. Let's
Oh really?
reviews.
Cool.
Reviews are really, really
That's
helpful
awesome.
um, when they
No, I
are.
appreciate that.
Yeah, go on.
No, I was going to say I'm wondering. Like, I also was impressed with what you were saying there about sort of your commitment to, well, clearly your commitment to what works, and I wonder it's so striking because I think we're in a sort of a similar position in the ecosystem, say in our organization as you are. I mean, we're not exactly the same, but in the sense that we're independent from the university system, so we're independent from the usual KPIs. And we also sort of have this commitment to actual sort of real world change. And we just see it from afar in a way when we look to the universities that, you know, researchers are just, they're incentivized just to publish anything. And whether it's going to come with sort of any real world impact or not. So I'm glad to hear you're sort of helping nudge people along that way to actually yes, validation papers are important, of course, but actually there's a lot more that we could be doing.
Yeah, I think it's about understanding what we already know and then working out what needs to be learnt next, actually, and then how to best achieve that. So there's a couple of things that we see that are really important. And actually, so we look when we look at reviews, we also look at what research needs to happen next, and that has two important. So we look at policy implications, practice implications. We also look at what research needs to happen next, and in which order. And that could be something quite conceptual, like actually look on social support. We're just measuring it in so many different ways. Like loneliness was a great example. Like we were measuring it in so many different ways. You couldn't compare apples with you couldn't compare. So actually, we need to go back to concepts, back to measures, get a better sense of it, and then we need to understand how they're working. And now we can say there's a lot more. We can actually say something works. Most things don't, right? Most things don't work, or they don't work any better than just a placebo, right? We should use that
Yeah,
effect.
yeah,
But what gets researched matters, and so what you can then do is take that research gap to a research funder, or if you're an academic team looking for something to support your application, drop in that this is needed into your research finding. And that's really important, so that we can actually make the most of that research money that's used, and that time and effort and all of that. And basically, can we make it cheaper, easier, quicker to do really high quality, robust research that people in policy and practice need? So it's also identifying things where actually, so like what gets researched is a great question. So there was quite strong incentives around people who've got a product and they want to prove it works, and therefore they spend money on research. And there's reasons to believe that or not, which is why we're here to sort of assess the confidence of it. But we're also thinking about what is it that's happening that doesn't get researched that actually practice really, really wants to know about. And so that research is practice relevant, policy relevant as well. And it's not just about getting a press release in the newspaper, because that's quite effective actually in terms of attention. But I mean, that's the sort of thing where I point out, wait a second, you've got these results, you called it a trial, but where was your control group? Like, that was just as, like, what happened to the rest of the population was exactly the same. Okay, before you switch your whole company over to this new way of thinking, perhaps you might want to look at this a little bit more robustly. I mean, it's up to you what you do in your own company, but if you're spending government money or whatever, then you want to be pretty clear that it doesn't do any harm. So yeah, trying to get that experimental approach happening more widely, so that we're sort of just thinking a bit more robustly about what we're doing. But what gets researched is a really interesting question.
Yeah, absolutely. And so do you have an example that you could share, like where you've maybe started from, something that you've noticed in the data that maybe has been supplemented with some, maybe you've then looked and found gaps, then eventually have informed policy? Like, have you got to that point where you've been able to get really from the ground up?
Yeah, there's lots of examples of that actually. A
Cool.
really lovely one that there's a review coming out next week that is quite important. So in 2018, the government here did a loneliness strategy. And loneliness matters probably in the negative rather than the positive. So social connection matters from our perspective, but loneliness is kind of the acute end of that. And we're British, and we can't talk about the positive. We can talk about loneliness and mental illness, but we can't talk about the positive. So that's fine. We are where we are. But so in 2018, we looked at the evidence for, like, what can you do? Like, you want to do something about loneliness. What can you do that's going to work? And we looked at the evidence, and that's where we found a couple of things that were quite interesting and slightly difficult for large amounts of enthusiasm. So we found that there was nothing that worked for loneliness, or not with any confidence, and we didn't find any interventions.
Is this no interventions? Okay.
Yeah, so things, and an intervention is a project, like something that you do to improve the outcome that you're trying to do. So it's not necessarily I buy this product. It could be, I don't know, as a charity we do this thing, or there's this policy that we do that allows this sort of. We found nothing that worked, and there were no interventions that were below under 55. So there was nothing for young people, like middle-aged people either. And we know from the data that young people are lonely, middle-aged people are lonely, as well as older people as well. And it's different types of loneliness in different places. And what had also happened is a number of projects had decided to do robust evidence, which is fantastic, but they kind of jumped to doing an RCT, or a randomized control trial, almost too quickly. And like, they hadn't even, the reason why those findings weren't good enough to be used in this way to say it worked was because actually they needed to do a lot more work beforehand to get it trial ready, or preclinical trials, we would say in other contexts. And we were measuring different things in different ways. And so we had to go back and work out, what are we measuring? What do we mean? Build that up. And then 5 years later, and we had an evidence gap strategy, and how do we fill those as an evidence gap map on our website. And we worked with researchers, and we worked with funders, and we worked with policymakers to say, okay, you're going to do this. So an example of funders is, actually, for people over 55, we did have a sense of types of things that worked. So you could probably fund and start to scale it and do evaluation around it. But for under 55s, for young people, it was much more, you're in the pilot innovation space, and the type of evidence that you need in that context was different. So that was exciting. And then 5 years later, which is now, we've looked again at the evidence, and this is not yet published, but I can confidently say that we now know some things that work. We have a much
Great.
broader sense of the evidence for different age groups, and the methodology is improved, and also the findings are more sophisticated. So this has happened on a couple of other reviews we've gone back to, where at one point everyone's like, oh yeah, it all works, isn't it lovely? But they're quite small studies. And then when you go back and they're better quality studies, actually the findings are more mixed, and that's much better. It's a sign of a healthier evidence base, right? And that's exciting. So that's sort of what can happen in 5 years with a concerted evidence strategy and a committed group of people who care about something that's important to people's lives.
Wow. Yeah, and I wonder how relevant is it that you're an independent basically within this environment? Because you mentioned before about pulling all these universities together. They don't traditionally work very nicely with each other, I think, or at least in Australia. How important is it that you're sort of like this independent stockbroker basically of this work?
I mean, I think it's a really important institution as a concept. So we're part of this thing called the What Works Network in the UK, which is a
Yeah,
group of
yeah,
organisations that do this cost effectiveness in different contexts, whether that's youth violence, whether that's education, whether that's health, all sorts of different things. And that is quite important because you need to look across the evidence base, right? And to be able to find that evidence quickly, to build on it, all that sort of thing. So I think that independence is important. And actually, I need to be able to publish regardless of what a company or a minister says. There has to be a public
yeah,
output, and that is the point. So the independence is important. I think this bridging role is important, but like I say, there's a couple of other problems on funding. One on well-being, like who owns it, and the other one is actually people fund research, often the primary studies, and they'll fund the thing that you're doing, the grant thing, but they won't often fund the middle bit, which is this translation, making it available to everybody. This sort of bridging role, which is harder to resource, actually. It's kind of a weird concept too, right? People don't necessarily know what it is.
yeah.
But I
No,
mean,
absolutely. And I think without a center like yours, it just doesn't happen. Basically, I think is the honest truth.
I think that's true. So I've talked about the loneliness example, and the civil society, so the charity sector and the government sector, actually looking back over sort of 5 years, we can see over 10 years, we can see that the volume and quality of the evaluation research has really improved in those sectors. So I can say with confidence, even if it's not an academic publication, there are some really high quality pieces of work done by those other sectors, which is really exciting. I cannot say the same in the workplace, actually. We stopped doing so much work in the workplace around 2018. And whilst it's some of the most popular content on our website, in fact, has been for all of those time, the quality of the evidence base around what supports well-being at work, despite like huge numbers more people being heads of well-being in organizations, loads more money spent on it, actually the quality of the research has not improved. And I think it does take concerted
Mm.
effort, which is surprising to me. I thought that would just happen, but it hasn't. And again, I think it falls into that trap of we'll fund research or we'll fund practice, but we won't do that middle bit, and we won't
Yeah,
look at it particularly seriously. Or we'll do it just
yeah.
for
I mean, absolutely.
ourselves.
Yeah, yeah, and like I mean, we fall into that boat a little bit, and we do have this challenge where research grants come out. They often come out as like a targeted call, at least in Australia. So we're looking for a priority population or some issue. They're always oriented towards an issue or a population. Workplace is kind of like the assumed healthy group of people in our society. Although I think you and I understand that that's not the case. So it is quite difficult to find research that would actually, or find research dollars, I think, that fund, high quality work in that space.
I also think there's it defaults to best practice really quickly and case studies really quickly because that's what the market
Yeah.
kind of wants, but they don't work and they're useless in terms of telling you what makes a difference. And so I think this needs a bit of leadership. Really, it totally can be done. We've done it quite a lot, but it just needs a bit of understanding that this matters and it's important to do, and that you're contributing to something bigger than yourself. That everybody, and particularly bigger organisations, where I mean, people are just people, regardless of where they are. small groups of teams form in different organizations, you can totally translate a lot of this to different contexts that can't afford it so much. So there is a sort of public
Mm.
good value in that, that isn't as clear as well. I think that's really interesting about workplace being a sort of healthy population, and they kind of are, but they kind of aren't. So if why the reason why we care about well-being overall, like what improves that, but we also care about three other areas. We care about place and community, because well-being varies by geography, and this sort of civil society, community, charity, peer support, helping each other, strength of civil society really matters, trust, all of that sort of stuff, social capital. So we look at, and that's why loneliness. But we also look at working age. And the reason we do that is because we're happiest at 23 and 68. The midlife crisis is real. We bottom out at 48 in the UK, 41 in Mongolia. And who looks at that population? There's a lot of funding for aging. There's a lot of funding for young people. But who looks at that population? And that's where, if you look at sort of the founding bits for both your centre and ours, it's around these deaths of despair, actually, which is exactly this. So deaths of despair are kind of the pinnacle of this, which is sort of suicide, drugs and alcohol, car crashes, I'd add, in the US now. But they're just kind of the tip of the iceberg of sort of poor well-being in that adult period. And we also know that despite working age being so important, employment is the third biggest driver of adult well-being. So being in a
Yeah.
job really, really matters. And that's probably one of the biggest drivers of some of the well-being increases we've seen in the UK is employment since 2010. So that is clearly a target population, but like everyone assumes that they're fine, right? And that young kids and old people will matter more. They do matter, of course they do, but so does this working age population.
Yeah, and I guess it's always that trade-off that we kind of talk about it at work, isn't it? It's like not only is it a priority population, it's a huge proportion of our population, and workplace is just such a efficient potential lever for work. For this ambition. They're kind of like they're there. There are populations that are really hard to reach. Yet, employees are generally much easier to reach. So yeah, that hope to see something changing. So you made a decision to stop chasing that evidence base, was it specifically, or what was it that you stopped in 2018?
So we did lots of evidence reviews. We took that to funders, and some work got researched. Actually, I just kind of thought we built the building blocks um, for it to happen much more quickly than it did, and we
Okay.
and so the thing we did find was that lots of things work to improve well-being at work. So the workplace is a complicated thing. So one, yes, it's a setting. People are there. If you think about it in public health terms, it's a setting like a school or anything else. It's a setting where people are. So you can reach people with public health interventions. So that's one thing.
Yeah.
And that actually is slightly different to what you might do to look after your staff, because you think it's a good thing to do to look after your staff for a range of different reasons, for retention, recruitment, performance. And that's slightly different as well. And so there are different incentives there about why you might do stuff in the workplace. And when you're comparing what works in the workplace, people often say, oh, these wellness interventions don't work in the workplace. Actually, that's kind of wrong, because often don't work, but they're not trying to improve. They're trying to be a public health intervention in a workplace setting, which is a slightly different conversation to the one we're having
Yeah.
about performance. But one thing we did find was that lots of things work in the workplace, lots of things don't, but most things do. And they improve well-being probably. And they're often led in an ad hoc way by sometimes a keen person, sometimes a different particular function within the organization, whether it's HR or a senior leader. And that's great. Where we're more likely to see both well-being and performance improvements is when there's an integrated organizational strategy. So we focused on that because we were like, okay, that's interesting. And in 2016, I'd say about 20% of organizations had a strategy. I would say that's much higher now, although I haven't seen the most recent data, but that's from what I've seen. And when we looked at we focused quite hard on like, how do you build a good one? And so there's lots of information
Yeah.
about how to build it, how to measure it, and how to choose things that matter. And then what we saw in the pandemic is that organisations that actually probably somewhat coincidentally had taken this seriously in the year or so before the pandemic were much more resilient, and it's because they were much better able to respond, and we can see that we've been able to look at that in the evidence, actually. So that is there. The intervention evidence is less well improved.
Yeah, interesting. Yeah, it's funny. We just had a meeting the other day. There's a centre here in South Australia called the Centre for Workplace Excellence, and they mostly come from sort of not at the individual level, but more sort of the workplace conditions and how that relates to sort of mental health and quality of life and other things. And it's interesting hearing some of those insights of what happened with working from home conditions, and they're almost telling this story of we've worked so hard over the years as a society to improve the workplace condition, and working from home has almost undone so much of that. I think obviously like the flexibility does come with some benefits, but in terms of like sort of hazards and all the other million considerations that have gone into the workplace, it seems like they've got a lot more work to do now. I don't know if you've come across of anything like that.
Yeah, I think this is really interesting. Like, everyone's obsessed with this work from home debate. There's a couple of things
Yeah,
that are really
yeah.
important to note here. Is that only about, I think, 60% of UK working age population ever switched to work from home in the pandemic. So it's not a huge proportion of people. The other thing to say, so most people continue to work on site in various ways. And so that's interesting in itself. Um,
Yeah.
there are lots of organizations and workplaces that have always worked remotely or
Mm-hmm.
as distributed teams, and actually there's quite a lot of learning we can bring from that, which is exactly what we did during the pandemic, actually. So we looked at teams that have always been remote. So I don't know, sales teams that don't actually ever work in the office together. That's really interesting. Submarine crews, people on there's lots of different places that people work. So there's a lot we can learn from places that have always done this. But I think it is worth looking at. I think places that did, there's a couple of organisations that I'm aware of who had these strategies before the pandemic, quite coincidentally, actually, um, were better able to respond, and their staff well-being is much better, i.e. the resilience stayed higher, um, uh, because they'd already looked at flexibility in workplace, and they had the technology and all those other things to do it. And so I think it's definitely worth looking at, but there are people who are doing this and done it well that we can learn from, which is the point. And we should just write it down
Mm.
and share it.
Yeah, yeah. If only it were that easy. Cool. So, can I hear from you? I don't want to. I'll hold you not for too much longer. Conscious of your time, and again, I don't know if I've said it now that we've been recording, but thank you so much for your time and for being here. Um, in terms of like the big success stories of the What Works Centre, there must be a few that you are just so proud of. It would be just great to hear some of those.
So I've taught, thank you. I mean, it's wonderful to collaborate again, by the way. Really enjoying it. Thank you for inviting me. Um, the big success stories. So the loneliness one I've talked about, there's a couple of others in that
Yep.
space around student mental health. We now have 1,000 papers a year on student mental health, which is exciting. Um,
Seriously.
yeah, that's been really concerted effort. There's a great podcast on that. I'm happy to share at some point if that's useful. And we looked at places and spaces and social connection. So the interaction between physical and infrastructure and social connectivity between people, social capital, that has also grown quite considerably, and that's quite exciting. And that is pre-pandemic stuff. So we're still expecting a whole load of studies from the pandemic period to follow. So it still takes 3 years for these to follow through. So evidence use and generation takes time, takes an average of 17 years to get from the evidence to practice change. And that's an average. So a couple of other things, and then the evidence itself takes sort of 3 years to follow, like a lag. So that's the other thing on funding, is that this is a long thing. It's not a short-term thing,
Yeah.
but it doesn't take a huge amount of money. We do it very cost effectively. Um, the the other successes are interesting in that sense. So we use three mechanisms: one, communication; one, learning; and one is institutional changes, and so building it into systems so they do things differently. And we are an institutional change. So on the comms side, an example is we did a study on loneliness in London, quite specifically because it was quite unique, and we looked at those factors. And unsurprisingly, people who've moved to London within the last 5 years are more likely to experience higher loneliness. And we just published that with the Greater London Authority, and somebody picked it up, decided they set up the Lonely Girls Club. 20,000, 30,000 young women part of that. That's really exciting. As an example as well, the power of just publishing the research in a public way that's accessible, and getting it out there and communicating it. We've trained over 4,000 people, probably more than that, which is super exciting. And then another example is we've built all the wellbeing methodology, including the wellbeing, into the Treasury guidance here about how you do policy making. And it's not necessarily the most innovative way of doing it, but it means it can, across all these different organisations, whether you're making an application for government money, you can use wellbeing evidence and data in a methodology in a way that is robust, consistent, and with confidence. So building it into that decision-making system, and then building the metrics into, so the measurement is key, right? You need the data to know how you better to measure sort of roughly the right thing about how people are doing than not measure it at all, right? So getting those measures into different sectors and making it make sense into them. So we now have the fact that the National Measuring Wellbeing Programme is still going in the UK. It's now published quarterly alongside GDP statistics, is super exciting. It's being refreshed, being published in July, which is super good. I think part of us continuing to communicate it has helped keep that going, and using it and understanding how you use that in practice. We've also built the metrics into the public health data system, so that if you're doing a joint strategic needs assessment at a local level, you can pull a profile of your place and the well-being of your place and its drivers at a touch of a button. And we can also help people learn how to use that. And that took less than 17 years, which is super exciting. So from 2017 to 2023, that change took. And then the last one,
I mean, that is just amazing.
Yeah.
It's just so amazing to be able to do that. So, I mean, are there? Could you give us two examples of the two areas that had quite stark differences in their well-being drivers?
So, yeah, I mean, the other thing is that wellbeing is now the overall outcome of what's called a levelling up. So I talked about there being, which is the main government social policy and an economic strategy, bringing together most social policy departments across government. And that I don't think would have happened 10 years ago. That is because there are variations in wellbeing across the country. So this idea that an average how we're doing isn't the same as like what's happening in Blackpool or Wolverhampton or wherever, different parts of the country. And so that recognition there are variations and that we should attempt to close them is quite important. And so that policy has happened, is happening. How we achieve that is a different question. Some examples of places. So we looked at from 2010 to just before the pandemic, we could see the local authorities, so the counties in the UK, where we'd seen the biggest changes in wellbeing, those 4 subjective wellbeing metrics over time. And we could see the ones that remained resilient or not during the pandemic. But places like Wolverhampton, places in Lancashire, the former mill towns in Lancashire, for example, also were particularly places that had improved. Probably largely to do with male employment, but a lot of other things as well. And then I think the other exciting bit is that you're thinking about, so that like in workplace, like in places, the drivers of what we're all human, right? The drivers of well-being are the same wherever we are. They just play out differently in what you might choose to do in a rural place rather than an urban place, or a town, or like different geographies or different workplaces varies. So our approach is understand your people understand the drivers of well-being in that context, and then think about what you can do. And then how can you maximize well-being from the thing that you're doing, whether you're a supermarket in a small town or a university in a city, or I don't know, maybe you run the river, you look after the river authority in the place. How can you maximize the well-being you get from that? Your volunteers, the biodiversity, the physical access to it. So during the pandemic, the Canal and Rivers Trust, which runs the canal network in the UK, became essentially the nation's backyard, particularly for places that didn't have a lot of green space to use. And they were,
Mm.
because they'd had their plan in place, they were able to tell us exactly how many people used the waterways for exercise and how much happier that would have made them in that context. And we can calculate that and value it now.
Wow. Yeah, I love that idea of, you sort of, we started off reading, that was kind of a line from your website, democratizing access to wellbeing evidence. But it almost sounds like you're democratizing almost like well-being responsibility in a way, which I think people want so responsibility, maybe what I actually mean is agency or empowerment. This idea of, there is local expertise, there's local knowledge. If we can supplement that, and I mean we as in your organization, if you can empower that by the use of the data that is available, you actually seem to be inspiring all these small well-being initiatives from the grassroots level, and that just seems incredible.
And as you know from the research that we did together, that feeling like what you're in control of your life makes a big difference to well-being. So the whole approach is intended to achieve that too. Yes. If anyone wants to collaborate on
Absolutely.
self-efficacy and control, would love to. We've got one on community agency and control coming out fairly soon, where we've looked at what works in improving that, like community action. But we'd love to do one on individual self-efficacy, because that was the big thing that came out of the research we did together. How do you
Fantastic. All
improve
right,
that?
really cool. Yeah, good question. Last question is like, this is probably not even really a question. Are you a football fan?
I am soccer, yes. Football, yeah, very much so. A sad season though
Because
for
I've
me.
noticed I've noticed some tweets, but tell me, who do you go for?
So I support Southampton Football Club. I've been going to their matches for longer than I've done pretty much anything in my life, with my
Really?
dad and my brothers. Yeah, because if you go from the age of 4 or 5 for 30 years, 30, 45 years, then actually there's longer than you've been in employment, that you've had a relationship, that you've had like school. Yeah, it's kind of the religion that you attend every week. But yeah, it's been a really bad season. Me and the Prime Minister share one
I
thing, and that
was,
is support for the football club that has been relegated.
yeah, that's tough. So they're dead last, if I understand correctly, right?
Yes, and I also know the data on this, which is if your team loses, you're
Tell me,
unhappy.
this is what I was hoping. This is what I was hoping
So
for. Let's hear it.
this is the mappiness research. So George McCarran and the team, which is fabulous. If my team wins, I'm happy for 3 days. If my team loses, I'm unhappy for 5. So I've had a miserable year.
Really?
I'm hoping now we've been relegated that we will have more wins. I think that this sort of shared misery, though, this journey that we've had together with like an intergenerational one with loads of people, there's something about sporting memories that are sort of important. And we can see, for example, the impact of the Olympics in the UK on well-being, and value it and measure it. So we, there is something about this shared experience that we all have of, in this case, total misery as our team being defeated.
Yeah, I mean, I remember hearing this a long time ago. Like, I support a football club, like an AFL club here in Australia. They haven't won the final since 1998. So they kind of, you hear like, I was like whatever I was at that, like under 10 at that time. But apparently, like, the economy boomed. They won two finals in a row, and like the economy boomed in response to that. So you can completely understand the sort of the happiness version of that sort of result.
Yeah, we've looked at
I wonder
place
whether,
based culture events and the evidence base around that. We'd love to do that on sport.
Yeah, amazing. I mean, I could imagine then there would be sort of like the downside of these things as well. Like we're talking about happiness, there might be sort of more distress signals that come from these things too. But I wonder, like, because you can experience such highs and lows as a fan. My friend has just flown to Napoli to be there for the celebrations in Italy. I mean, I think they're going to party for like the next 6 years. I think those guys, they're not ready to stop.
I mean, you still remember, like, I mean, I wasn't even born when we won the cup. We still remember when we won the cup. And I still remember the moments when we went to the cup final and we lost, and it was still a memory that we have together. So there is lots to do that. So there are obviously these positive impacts. There's also negative impacts as well. So the choice there is, how do you like, this is the approach we take to everything. How do you maximize the positive impact that you want to achieve through what you're doing, and
Yes.
spot and mitigate the negative ones? So the example is, actually, regardless of whether you win or lose, domestic violence goes up on a match day, which is interesting. Um,
Regardless, really.
yeah, and there's also some other ones. Obviously, you can imagine the impacts of partying on a place, or like how football fans aren't always the most, or sports fans aren't the most well behaved, for example. Then also understanding more fully the impact between um, seeing someone play and you participating in physical activity, which isn't quite a straight line. So there's been a big focus, obviously, on women's
Mm,
soccer, and I'm super proud of both, actually, the UK, the England women's rugby team and the England women's football team, who've just been brilliant and super inspiring for my young girls. And I wasn't able to play after secondary school. Till secondary school, I wasn't allowed to play football. I had to switch to hockey. So I think that change has been hugely significant, and women's and girls' physical activity is one of the reasons for their poor mental health. So that's really important.
yeah.
But understanding those relationships better. We have worked with the clubs, community foundations in a number of sports to maximise the impact that they can have in that area. So things like, often the club is the most trusted thing, right? It's the thing that you identify most with, that you care about. So that sense of community is important. It matters to us. But also things like walking football, accessibility for people with disabilities in the area. So, I mean, the
Mm,
stadium's not used during the week, so can you use it in different ways? The difference it makes seeing your favorite footballing hero come and visit you when you're sick, or being a mascot is something you remember for your rest of your life. So how can they maximize the impact and joy that they bring through what they do? And that's been really exciting. We've got them measuring well-being in the football league here.
wow, that's incredible. Very cool. That's awesome. Well, I hope for your sake, Southampton are back up next year. I've
Me
heard
too.
that. I've heard that the relegation, or firstly, I wonder, the championship is your second division, right?
Yeah, yeah.
Yeah, hilarious. Like I think I just saw Ted Lasso making a joke about that. Like, how is the second division called the championship? But um, I wonder whether a championship win equates to the same amount of happiness as a Premier League win, or even for that matter, a Champions League win. Just that's a side note as a soccer fan, I think. But yeah, I mean, I hope they don't have the same fate as Sunderland, poor old Sunderland.
I
I
mean,
watched that documentary. Even my wife, who doesn't really get into it that much, we watched that, and it was just heartbreaking.
yeah, I mean, it really is, like, the emotions you go through. And Ted Lasso is just fantastic. I mean, what a brilliant program about teamwork, right? If you wanted to
Yeah,
communicate what works around teamwork, like, that was superb. Really great bit of telly.
very cool. All right, well, that's a great place, I think, for us to end this conversation. I've really enjoyed it, Nancy. Thank you so much. Um, I'm just checking how far Sunderland is from Southampton. I'm noticing that they're literally top to bottom, could not be further apart from each other. So whether that predicts your success rate, hopefully it does. Thank you so much for being on the show. I've really enjoyed. I'm just in complete awe of what's happening in your team. So yeah, thank you for your time.
Thank you, and likewise, really great to connect again, and would be really happy to collaborate with you or colleagues across Australia as well. So there's so much we can learn, together. Let's try and create a system that really actively learns. We can totally do this now. It'd be great to see it happen.